Happy Saturday. Grab a cup of coffee with me and let's talk updated research. I just spent the week at the Child Neurology Society meeting and I'm going to share what I learned and some key takeaways. The Child Neurology Society is a society for medical providers that specialize in child neurology. In the US, there are about 1,200 child neurologists, which is very small. And there are about 600, I think, in attendance at CNS. There's trainees, there's established researchers, there's clinicians across all sorts of research areas and clinical interests. And there are, of course, a couple of advocacy organizations that attend CNS. I hope to see more next year and the years after. But it is a wonderful place and a smaller conference, unlike some of the larger epilepsy and neurology conferences, to have really meaningful conversations with people that are focused on, specific area interests like neonatal neurology and HIE. First up, you probably saw this video. If you haven't, go ahead and check it out. But basically, we planned out, they have different sections called scientific interest groups. And so the neonatal scientific interest group, obviously neonatal neurology, very related to HIE. And we've been working with the leadership of that group to start the conversation about long-term follow-up guidelines for HIE, since none currently exist. If you haven't seen this was a big win. We expected 50 people, about 30 people confirmed that they were attending, but normally people don't all sign up. So we're like, okay, maybe 50. Printed 75 copies just to be safe, and we had 120 people show up to start the conversations. Very, very robust conversations. Anything from me cheering and going, yes, everyone gets it, to people that have done things a certain way their entire careers and thinking that they should not be naming diagnoses to our families, including about infantile spasms, which was kind of the big talk, in an effort to preserve parental anxiety, which we all know as parents does not get preserved if you do not name actual clinical medical terms to us, because we're just going to find them and then the trust is broken. So again, a great avenue to bring that point up. Really, really robust and a great way to start this off. So if you followed for a little while, or even if you haven't, Hope for HIE has been a part of the Neonatal Seizure Registry collaborative since 2019. NSR has actually been going on for over 10 years, and it's looking at life with neonatal seizures. HIE is the top cause of neonatal seizures, so obviously the intersection of this work is really, really relevant and important to our families. We have several families that serve on this group. It's not just me representing Hope for HIE. We have different families from different hospital sites that have an HIE background as well. So this poster is talking about characterizing the longitudinal parent experience. So at age 5, parents were given surveys of like how their mental health and well-being, their family's health and well-being, their family structure, all of that is impacted, and really, kind of quantifying what all of that talked about. We're going to be hosting a Q&A with Dr. Monica Lemon and Natalie Field, who is a med student that is working with Dr. Lemon at Duke. And that's later on in the month, so make sure you join us for that, because it's going to go into all the NSR work that I'm going to cover in much more depth. Okay, this one I have been wanting to talk about for a long time because I have seen and reviewed the data with the other members of NSR, and I'm so excited that this was like in a public format. Dr. Renee Schellhaus, who is on our medical advisory board and one of the principal investigators of NSR, also presented it in her award lecture. This is really groundbreaking data that's going to be published. I think the paper has just been accepted from what Renee said at the conference. This is showing at age 5, 80% of families across the spectrum of outcomes, including otherwise typical development, show behavioral impacts from their beginning. Obviously, we see this all the time as parents are saying, why is my 4-year-old, 5-year-old, 6-year-old, 7-year-old having all these behavioral issues and concerns, and how do we help them through this? No one's even recognizing that this is a problem. This data is going to be published. This is going to be groundbreaking, and this is something that you can take once it's published to your providers and say, here's the latest data. It is a problem. Okay, so next, I covered this one at the Pediatric Academic Society meeting after that. This is Dr. Emily Garavati. She is just coming out of her fellowship for neonatal neurology. She's a child neurologist, and she was in Oregon, and now she just got a job at CHOC at Children's Hospital of Orange County, working with people like Terry Inder, who is a famed neonatologist who has done a ton of work with HIE and in particular with like neonatal MRI. So really great crew there at CHOC. Emily's work is all about holding during therapeutic hypothermia, cooling in the NICU, and the rates and a QI possibility. So her first data that she shared actually at the PAS meeting back in May was really just on the parental hold rates and parental perspectives. This time she included nursing data of where the gaps are and how many nurses say that the physicians tell them they can't hold, how many physicians are saying the nurses aren't comfortable with holding, and really getting to the crux of the issue so that way we can improve this. And there's many different sites that are have a whole protocol of which babies can be held safely during cooling and what babies maybe not be ready for that. So this is happening, this practice change. So I'm really excited to see this. I'm going to be speaking in under a month at the Hot Topics in Neonatology conference for the first time, first non-preemie parent to speak there. And I'm going to be presenting a session on quality improvement in the NICU with full-term babies, of which we're going to focus on holding during cooling, feeding during cooling, naming the diagnosis, connecting families with support, all the things that we all know and are big advocacy topics of neonatal neurology and care in the NICU. Here's another NSR poster, this time about a question prompt list for parents. And this is actually really not only a communication tool for families to help like make sure, I know a lot of people can relate of like, I don't even know what questions to ask. I remember thinking that acutely myself. And this doesn't just help families. This helps providers who often like don't know if they're being thorough enough. They worry about providing too much information. They don't want to overwhelm people. So they're going to be talking about this at the upcoming Q&A as well. Okay, this one I'm really excited to talk about. This is Dr. Melanie McNally. She's at Mass Gen, Massachusetts General Hospital, and she is doing work in basic science, which means preclinical. She is using the HIE mouse model to look at mild HIE, which we know needs a ton more research. She's doing the work. She's looking at what do we know and what can we learn about mild HIE in the mouse model that might be something we can look at to improve care, to develop better therapeutics, and really show that burden of disease, because we know that this part of HIE in particular is lagging in research. And so her big findings that she published for this poster is that neural death happens like down several weeks after the initial HIE event takes place for mild, which can also look at how be a positive of finding optimal times to then mitigate, that neuron death. So pretty rad. And that's, again, probably why MRIs show up more normal for mild, because we're talking neurons, which are small, and not grand cellular death. Some of you may remember the sleep survey that we did a few months ago, and then we published on with Dr. Renee Schallhaus about sleep and HIE. This is very related, and it's another NSR one that Monica and Natalie will talk about in the Q&A coming up. But sleep disorders among 5-year-old survivors of neonatal seizures. And this data shows that it is not just the moderately to severely affected kids. It is all the kids have, not all, not 100%, but a significant elevation of kids have sleep disorders and sleep issues and parent-reported sleep issues 5 years down the line, which again, we know. So really excited to see this get published and move forward with more research for our community. Dr. Danielle Barber on our medical advisory board put together an amazing session on the impact of social stress on early life brain injury, including HIE. This is showing that the home environment can modify, not fix, but modify brain injury and improve outcomes. And so there's not enough emphasis on the home environment and its importance, as well as social determinants of health. And so this is really important. Shout out to Dr. Monica Arroyo, who is also on our medical advisory board, who gave the year in review about neonatal neurology, talking about the importance of partnering with parents in communication. Let me know what questions you may have.